Thank you. Speaker, like many Nova Scotians, I was shocked to see that the government has cut from in this budget the Office of Health Care Professionals Recruitment. As everyone knows in this legislature, including the minister, Nova Scotia has a severe shortage of healthcare professionals, and it's only going to get worse in the next 5 years with retirement. This office helps new healthcare workers find a home, childcare, schools, and a connection in the community, and it's done so well in rural areas. How does this government expect to recruit healthcare professionals when they're cutting the recruitment budget by 20%?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. So the reductions that were shown the other day is actually a reduction in the discretionary grants, and we did look at the community recruitment funding. So over the last number of years, there's been a $2 million fund that we have used to support communities across the province, doing things like creating websites, pamphlets, promotional material for their areas. So after that foundational investment, we're now moving to a maintenance phase, and we feel that this is an adequate amount of money in order to support ongoing community development, for recruitment and retention. We'll work with those partners to understand it was a grant-based program. Some people had several grants in a year. Others have only gotten one, but it really has been around investments that will create foundations for them to move forward in their recruitment efforts.
I recognize the Honourable Member for Halifax-Armdale.
Madam Speaker, we learned when the Liberal government went to one health body and they took recruitment out of the communities, there was a huge deficit. When it came back to the communities like Yarmouth took ownership and were very, very successful in meeting housing needs, home care. So why is the minister cutting back communities' abilities to support new recruits and keep them?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. So there is operational funding that still exists, and we do know that across the province there's different ways in which communities recruit. Sometimes municipalities, as an example, have a recruiter. Nova Scotia Health is still heavily involved in the recruitment and settlement work that's happening across this province. They have paid employees and teams to do that. This is around community-based organizations. We've been working with them for several years, looking at ways in which we can support them in creating a foundation for promotional materials, as an example, or engagement activities. So there's an opportunity now with that foundational investment for folks to work together as they have been and maturing over the last number of years. Our recruitment has been excellent. We have a net new 570 physicians since 2021, and we're very grateful to our partners, and we'll continue to work in community.